Good morning, ma'am. My name is Mishi Pallav and today I will discuss about cardiovascular system. I will discuss about three topics. First is palpitation of heart, second is trembling of heart, third is auscultation of heart. Let us begin. My first topic, palpitation of heart. To measure the palpitation of heart, we find the apex beat point. We ask the patient to incline forward and put our hand over the breast area. Then we slightly slide our hand towards the sternum. Here we find the apex beat point. Now I will state some properties of apex beat point. Location 1 to 1.5 centimeter inwards from the left mediaclavicular line. Now area 1 to 2 centimeter square. Now strength middle, height middle, resistance no resistance. In cases of pathology, we see that the location increases or is more than 2 centimeter in cases of left ventricular hypertrophy. Now, second topic is trembling of heart. There are two types of trembling, systolic trembling and diastolic trembling. Let us now locate the diastolic trembling. We place our hand horizontally over the left side of the chest near the heart area over the pectoralis minor muscle. This area is near the mitral valve. In healthy person, no trembling. In cases of pathology in patient, trembling. This occurs in cases of mitral valve stenosis. Now let us locate systolic trembling. Place our hand vertically over the aorta, second intercostal area. Trembling is not felt in healthy person, but in cases of pathology, patient feels trembling, such as in cases of aorta valve stenosis. Now let us move to our third and last topic, that is auscultation of heart. For this we use a stethoscope and measure the heart sounds. Place the diaphragm of the stethoscope over the first point, that is the mitral valve point or the apex beat point, located in the fifth rib, left side of the sternum, inwards 1 to 1.5 centimeters from the mediaclavicular line. First sound louder than the second. Now second point is the aorta valve point or aorta artery point. Place the diaphragm at the second intercostal area, right side of the sternum. Second sound louder than the first. Just opposite to the aorta on the left side of the sternum, in the second intercostal area, we find the pulmonary artery point. Second sound louder than the first. Fourth point is the tricuspid valve point. Here it is located on the left side of the sternum, nearly on the fourth rib. First sound louder than the second, but compared to the first point, mitral point, the sound intensity is low and it is quiet. Our fifth and last point occurs only in the cases of the pathology, that is known as Botkin's herb point. That is located near the third rib and is on the left side of the sternum. Here the first sound is equal to the second sound. Now I will do conclusion. In cases of healthy person, we find systemic, rhythmic and clear sound. But in cases of pathology in patients, we find additional sounds like murmurs, and the rhythm is arrhythmic, it is not symmetrical. Now I will list some examples, like in cases of mid-systolic murmurs, it occurs in cases of aorta valve stenosis. Then mid to late diastolic murmurs occurs in cases of mitral valve stenosis and tricuspid valve stenosis. And now early diastolic murmurs occurs in cases of aorta valve regurgitation. Thank you for your kind attention.